Hello, and welcome to another episode of Your Health, Wealth, Happiness, and Spirit. My name is Caitlyn, and I'll be your host for this episode on diabetes. And since November is Diabetes Awareness Month, we brought in Dr. Sadiq to tell us more about this condition. Welcome, doctor.
Thank you for having me.
So let's get right into the basics. What is diabetes?
Diabetes is a problem which we call chronic condition where we do not have enough insulin because our pancreas are not making either enough insulin, or if we do have enough insulin, it is not very efficient or it does not work properly. So it does not break down the sugars in a right way. So that is what diabetes is. The main problem is in pancreas. And then even if we have pancreas and making good insulin, but the insulin is not working properly. So that is diabetes, but it doesn't stop here. Once we get the diabetes, we have like a lot of bad conditions which we call heart attack or stroke or kidney diseases. Those conditions are because we have diabetes. If we don't have controlled diabetes, we get those bad medical conditions.
Okay, and now many people know that there are type 1 and type 2 diabetes, but are there any other types that we don't know about?
Yes, actually there are three types of diabetes. One is type 1, the second is type 2, and the one is gestational diabetes.
Now, can you go more into what type 1 diabetes is and some causes?
Yeah, type 1 is usually caused by an autoimmune reaction, usually develop in children and teens. 5 to 10% of the cases are actually type 1, so it's not very common, and we don't know really how to prevent this.
And now moving into type 2, are there any different causes for that condition?
Yes, type 2 is most commonly, actually it's 90 to 95% of the diabetes are type 2 diabetes, and it develops during the course of the years, and it's also known as, it causes and actually family history very important in type 2 diabetes. It actually mostly the lifestyle, if the lifestyle is not good, we are sitting and eating all the time, you can get type 2 diabetes.
Okay, so now since we've went over type 1 and 2, let's go over the third one that's not as familiar, and you said it was gestational diabetes?
Yes, it's a gestational diabetes. It happens in pregnant women. So if the pregnant women have, they get this diabetes, so children who are born, they also are at risk to get the diabetes later part of their life. And even the women who get gestational diabetes, they also can get diabetes full blown later part of their life. So it's also very important to keep an eye on all pregnant women on their blood sugars and talk to your doctor.
Interesting. And I've also heard of pre-diabetics, and it's known that 1 in 3 Americans actually face this condition, but 84% of them don't even know they have it.
Absolutely, absolutely. It's so common. Pre-diabetic, a lot of people have this problem, and that problem is because of the overweight. We have obesity, and just being overweight, that is so common, and because we have overweight, that directly related to the pre-diabetic. So it's very, very important that you every year when you have your physical done, make sure you check your blood sugar, talk to your doctor.
So it seems awareness is really critical in preventing this diabetes. And is there a way that people that are pre-diabetic can prevent it from developing into type 2?
Absolutely. This is where I tell all my patients and to the general public that you are your own doctor. If you keep an eye on your body, that is the most important. You will see doctor once in a while, like once every 3 months or once a year. So, but you are seeing and you are watching your body on a daily basis. So you have to be very careful. Your lifestyle is very important. Regular physical activity, that's extremely important. And watch your diet. I know I love food. I'm not telling people to stop eating, but watch what you eat. That's the most important. You can eat anything, but eat little. And watch, do calorie count or balanced meal, have the vegetables, meat, fruits, ice cream, cakes, you can have everything, but have little bit. Quantity is very important.
And there's also a tip that I've heard where you can balance your plate, actually. You quarter.
Yes.
Yeah,
yes.
could you go into that a little bit more for people?
Actually, I think we have, for centuries, they say that protein, carbohydrate, and fat. So 60% we can have our 40% we can have our carbohydrate, 30% fat, and 30% protein. So you cannot just totally avoid sugar, you cannot totally avoid fat, you cannot totally avoid protein. So we have to have a balanced meal. We have to have a meat, we can have some butter or some olive oil and some vegetables and fruit. So that is the carbohydrate, protein, and fat, they all have to be proportionately in your plate. That's very important.
Well, I know I can't live without my carbs, but thank you for the great advice. And do you have any other parting words for our audience?
Yes, I would suggest that it's very difficult to avoid the fun-loving food, but you can eat it cautiously in a small quantity. Stay on top of your health, because as I said, that you are your own doctor. You have to keep an eye on you. Talk to your doctor about your concern. When you go to the doctor, write down all your points so you don't forget. So, and ask them if you can have the test done for your blood sugar, if you can have a test done for your kidneys, for your liver. So you should have at least yearly blood tests done. So take care of yourself.
Thank you, doctor. And that's all we have here for today. So thank you for watching another episode of Your Health, Wealth, Happiness, and Spirit. And don't forget to watch our other videos on our now public YouTube channel called Your Health, Wealth, Happiness, and Spirit. Other than that, we are all set, so stay happy and healthy, and we'll see you next time.